Good morning. Thanks for joining us for this press conference in which we are releasing a report on the cost of banning abortion in Pennsylvania. Abortion is a critical healthcare service received by millions of women and other patients ranging in age from teenagers to those in their early 40s in Pennsylvania. The right to abortion is part of the personal autonomy that's a right of all human beings. And that's the fundamental reason why we shouldn't ban abortion in Pennsylvania. There are other very important reasons, including health complications and the implications of abortion for intimate relationships and the potential for sexual violence that's generated if those relationships are disturbed by unwanted pregnancies. While less striking than these issues, an abortion ban will also have substantial economic costs, both for individuals, families, and for the state as a whole. While other issues may be more prominent, we think it's important that Pennsylvanians understand the cost of banning abortion economically for our state as they consider their own position on the issue and the position of various candidates for office during this election year. With that preface, I want to turn the morning over to Claire Kovach, who is the chief author of our report on the cost of banning abortion. She's going to give us an overview of the evidence about the economic costs of abortion and also talk about what we think the cost would be in Pennsylvania.
Thanks, Mark. Good morning. So the paper we're releasing today draws on decades of research about women, abortion access, and life course outcomes. We review rigorous research that shows how further restricting or banning abortion would lead to severe harm for women and others in the state, and especially for women of color and women with low incomes. The inability to secure an abortion can be detrimental to women's physical and mental health. Additionally, a lack of access to abortion care makes it harder for them to get an education, reduces their prospects for employment and good wages, and greatly increases their chances of facing hardship and poverty. We conclude by arguing that, grounded in a previous estimate by the Institute for Women's Policy Research, the combined direct and indirect effects of a total ban of abortion in Pennsylvania would likely reduce wages in the state by $10 billion a year. So we begin by outlining the economic context of Pennsylvania today. We review research that shows how important education is for wages. Pennsylvanians with less than a high school education, high school level or equivalency, or even just some college, have seen their wages stagnate or drop over the past 40 years, while the median wage for workers with a bachelor's degree or more has increased by almost $10 per hour in that same time frame. Education is still highly predicative of future wages. Pennsylvania women only earn around 79% of what Pennsylvania men earn. We show recent decades how women's median wage still lags men's, both in the United States overall, but with an even greater gender divide in Pennsylvania. We outline how median wages for Black and Hispanic workers trail wages for white workers. In 2021, Hispanic and Black Pennsylvania workers earned a median wage that was only around 72 to 76% of the median white workers' wage, respectively. So we outline these facts to show that we have a lot of work to do to create greater economic equity in the state. Next, we move to outline the current abortion context of Pennsylvania today, the current restrictions, the current number of clinics in the Commonwealth, and we even touch on the abortion policy environments of Pennsylvania's surrounding states and how that might impact Pennsylvanians seeking care. We highlight national and Pennsylvania data about who gets an abortion, how nationally most US abortions are for women who have never had an abortion before, how, again nationally, 49% of women who seek abortions live below the federal poverty line, and how 75% of abortion patients are considered poor or low income. The majority of women who seek abortions are already mothers, and cite wanting to better provide for the children they already have is a strong reason for wanting an abortion. We outline some racial disparities in who seeks an abortion and who would be most impacted by further restrictions or a ban. We show an age breakdown of the women specifically in Pennsylvania of the 32,000 abortions who were that were received in 2020. The bulk of this paper focuses on three things that would be heavily impacted by an abortion ban: women's education, their experience with poverty and hardship, and more specifically, their employment wages and income. Under education, we show strong evidence of how restricting abortion access reduces a woman's ability to get an education. Pregnancy, its complication, and even child rearing all interrupt schooling, often permanently. From high school completion to college enrollment and college completion, a parent's education level is a powerful predictor of children's future attainment, and your education level is a strong predictor of a host of positive life outcomes, your future health, your longevity, your financial and job stability. Related, we discuss how abortion restrictions and bans disproportionately impact low-income women. While poverty is often experienced in spells over someone's life course, a shock like an unplanned pregnancy and the costs associated with it, financial and otherwise, can snowball and just costing individuals, families, and even entire communities more than they can handle, with or without outside support. We highlight data throughout this paper from the Turnaway Study, which was a decade-long research project that followed women who wanted and were denied abortions. Those researchers found that even years after the Turnaway, women who were denied an abortion were more likely to report not having enough money to cover basic life necessities like housing, transportation, and food. In a greater labor force context, we discuss how access to abortion has just been a great driving force for women's labor force participation, especially for Black women. Again, highlighting the Turnaway Study, researchers found that women who wanted and were denied an abortion were much more likely to be unemployed 6 months after giving birth than women who wanted and had abortions. We discussed some specifics around wages and poverty, government safety net receipt, bankruptcy, evictions, and even tax liens. While certainly not comprehensive, we touch on physical and mental health costs associated with being forced to carry an unwanted pregnancy to term, especially the life-threatening and lifelong consequences. We review Pennsylvania data about the race disparity in health outcomes for mothers. Lastly, we estimate the combined direct and indirect effects of a total ban on abortion in Pennsylvania, estimating that it would likely reduce wages in our state by $10 billion per year, an estimate that we think is actually conservative. Our estimate is grounded in data from the Institute for Women's Policy Research. They generated an economic and labor force impact estimate for Pennsylvania's current abortion restrictions. And while Pennsylvania isn't among the most restrictive states, we clock in at about a 5 on a 7-point scale, labeling our state as more restrictive than many, but not the most restrictive. So the price tag these researchers put on how these current restrictions reduce labor force participation and earning levels for women, while also increasing time off and turnover among women ages 15 to 44. Their estimate was $5.3 billion per year, just under the current restrictions. So if a full abortion ban is enacted in Pennsylvania, it's uncertain exactly how many more women would be prevented from abortion access, but we have confidence that the economic cost of the full abortion ban in Pennsylvania would be more than double the IWPR cost estimate, or over $10 billion yearly in Pennsylvania alone. We took into account who travels for abortion care now, the location of Pennsylvania's 18 remaining abortion clinics, and the abortion care environments of our bordering states, and even the percentage of abortion patients who live at or below the poverty line. And we even included recent increased donations to organizations that help connect people to and foot the cost of out-of-state care. We still think $10 billion is likely a conservative estimate. The 1973 Roe decision secured a critical health service for women. The paper we're releasing today shows that restricting or ending that access to that care is costly in so many ways and will have negative intergenerational impacts on families and communities. An abortion ban would be expensive in many different ways and would hurt the most vulnerable Pennsylvanians the most. Thank you.
Thanks, Claire. Let's just see if there are any questions. I don't see any, so I think we'll just wrap it up. I want to thank you for coming to this press event. I just want to, remind you all that we've drawn on a great deal of research done by others today, and we've tried to be fair to that research. We've tried to be very conservative in coming up with our estimate of the cost of abortion in Pennsylvania. But that cost is severe. We're talking about a 3% reduction in wages in the state, given our current estimates. And then I finally want to remind you that the economic costs are severe and serious. That's not the fundamental reason to oppose any restrictions on abortion. We firmly believe that abortion is a basic right of all human beings. It's one of the rights of personal autonomy that should be still enshrined in our Constitution, and that our politicians should be working to put into statutory law, given the overturning of the Roe versus Wade decision. And with that, I'll say good morning and have a good day, everyone. Take care.